Portion of New Day Northwest is sponsored by Virginia Mason.
Welcome back, everybody. Early detection is key when it comes to cancer, and a screening mammogram is usually the best way to detect and successfully treat breast cancer. Here with guidelines for screening mammograms is Virginia Mason radiologist Dr. Peter Eby. And please welcome also breast cancer patient Leslie Jolicoeur. Thanks to both of you for being here. Thank you. Really appreciate it. Dr. Eby, I can tell you, and I'm sure there are other women here too, that mammograms are not particularly fun. Not fun, but important. Why is that?
Well, you're absolutely right. They are important. Basically, the data that we have on mammography shows that when we start at 40 and we screen every year, we save lives. And in the United States, since the late 80s, when screening became widespread, the death rate from mammography has decreased, or death rate from breast cancer because of mammography has decreased by 35 to 40%.
Now, we've seen some new advances. For example, this year I got my first 3D mammogram. And it was the first year in a long time that I haven't had some false positive or biopsy that I had to go back for. So I don't know if that's because it was a better mammogram, but it certainly seemed like it. Is that an advance that's helped people?
That is exactly one of the benefits of digital breast tomosynthesis, which is also called 3D mammography, is that not only are we able to find smaller cancers in dense breasts, but we're also decreasing the callbacks for false alarms.
So you say we should start at 40?
I do say we should start at 40.
Because the guidelines have been typically 50, right?
Well, in this country, for a long time, the recommendation was to start at 40. And then in 2009, the United States Task Force looked at the data again and changed their recommendation to 50. But the American College of Radiology stayed at 40.
Okay.
And now in the last year, the American Cancer Society has come in at 45. So there is some confusion about when to start.
Right, but if you have a family history, should you kind of insist on 40?
That's a great question. So patients who have a significant family history, say a first-degree relative, mother or sister who had cancer before menopause, that would increase the family risk. They should absolutely start at 40 and maybe even earlier. What we're saying is for average risk women, the recommendation would still be to start at 40 because all these other groups agree that that is the way to save the most lives.
Okay, that's good to know because we want to be proactive about this. Leslie, were you good about getting your mammogram every year?
Yes, I have been very diligent about every year doing it, which is why when they found something this year, it was fortunate for me. It had only been a year since my last one.
Right, so caught early. What did they find?
Early. They found a 7-millimeter tumor in my left breast.
And what happened in terms of treatment?
It was fast. Everything went very fast. I had
as it should.
As it should. I had a biopsy, and then I had surgery, and then I am done.
Did you have a lumpectomy?
I had a lumpectomy.
And this didn't require radiation or chemo?
I had radiation while I was on the table, so I don't have to go back and do any radiation. There is no chemotherapy.
Wonderful.
I am cancer-free right now.
You are cancer-free right now. Thank you. I'm so very glad to hear that. And so the biopsy revealed that you had a pretty aggressive form of cancer, right?
It was a grade 3, which is the most aggressive, which is why they like to do something about it in the short term rather than wait another year and see what happens.
Yes, that must have been a comfort to you because my feeling would be that you'd want this, let's do this thing and go on. So Dr. Eby, tell us the difference between a screening mammogram, you're just going in for a mammogram, and a diagnostic mammogram when something seems to have been found.
Yeah, so Leslie had both. So first she had the screening, and screenings are for women who feel absolutely fine. They have no symptoms, no problems, and the great thing about screenings is that in the vast majority, everything is fine. In fact, I think of screening as this opportunity every year to come in and just reassure yourself that everything's fine. A diagnostic mammogram is done either when the radiologist sees something, as in Leslie's case, and wants to take another look, or if a patient feels a lump or their provider feels a lump or the patient has some new change in their breast and we're really investigating what's causing that specific change, then that's a diagnostic mammogram.
Okay. Now in Leslie's case, it's not just family history. She's actually had breast cancer. So what happens to her in terms of recommendations for screening now?
Oh yeah, great question. So now that she has a personal history of breast cancer and she's a survivor, she technically has a slightly increased risk over the average patient. And for her, we would sit down with her and talk about what things she might do in addition to mammography. We might consider adding breast MRI every year to the mix, or making sure that she gets a 3D mammogram every year, or talking about other things that she might do to decrease her risk in the future, like take tamoxifen or some other
But
drug.
you're not currently doing it.
No, I am.
You are taking
I'm already on
tamoxifen.
tamoxifen, yeah.
And now tell me who that's helpful for, because I know there's some estrogen positive, negative situation that tamoxifen helps some people and not others. Can you explain that?
Right, so there are different kinds of breast cancer, as we now know, and Leslie had one of the fastest growing types of cancers, which again is why getting the mammogram every year was really important. If the tumor has estrogen receptors on the surface, and we do tests to figure that out, then tamoxifen can help suppress that tumor and future recurrences or future tumors.
Okay, that's good to know. All right, you're going to join us for our panel. We'll talk about this a little bit more. And someday there's going to be a pain-free mammogram. I just know it. We're going to work on it. To schedule a mammogram or to learn more about recommended guidelines, please visit virginiamason.org/mammography. After the break, we're going to talk about Medicare coverage, the options,